Hello, I'm David Hutton of Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020, and I'm joined by Dr. Sanjay N, who presented evaluation of intraoperative use of DEXYCU on the signs and symptoms of dry eye. Dr. Rao, thanks for joining us today, and tell us about your presentation.
We put together a study that was completed last year looking at whether the use of intraocular DEXYCU during cataract surgery would have an impact on the signs and symptoms of postoperative dry eye after cataract surgery. So we evaluated several dry eye parameters and looked at outcomes using a regression analysis and found some very interesting results. Well, again, as most ophthalmologists are aware, the landscape of pre-op and post-op regimens around cataract surgery is constantly changing. So there's more and more interest in looking at how to decrease the eye drop burden for most patients in the post-op setting. So, products like DEXYCU have been developed to really decrease that post-operative drop burden. We were really interested in looking at whether the use of an intraocular steroid, in addition to kind of a standard cataract regimen, would really have an impact on both inflammatory signs and in particular the signs of dry eye. That's really what we were focused on. And I think the impactful part of this study is that when everything else is controlled and you're just adding DEXYCU intraocularly, there is a statistically significant impact on patients' tear film osmolarity, their corneal staining postoperatively, as well as patient satisfaction. And we certainly didn't see that same degree of effect with a standard cataract regimen of just a steroid topically and an antibiotic topically. Well, I think the take-home message is there's always more to learn and more to study, but I think in this small study that was randomized and controlled, we were able to show that there's a statistically significant improvement in dry eye signs and symptoms with the use of an intraocular steroid during surgery. I think especially in folks who may be prone to having dry eye after cataract surgery, it may be worth considering using an intraocular approach to the postoperative regimen to really minimize those symptoms of dry eye.